I'm Jennifer Gerson, president of Pinecrest Business Association, and I'm joined today with Luis Mejer from 24-Hour Nursing Care. Luis also sits on our board of directors, and he is a partner member with Pinecrest Business Association. And we're coming to you live today from the community newspaper studios. A big thank you to Grant and Michael Miller for always hosting us. We appreciate your generosity. So, Luis, tell everybody a little bit about yourself.
Hey, Jen. So thank you for having me. I really appreciate it. So 24/7 Nursing Care is a licensed nurse registry in the state of Florida, and we care for the elderly. We care for people post-surgery. Anybody that needs help in the home or in a facility can call us up, and we can help them either with skilled nursing services or custodial care, whatever it is that they need.
And then in what areas do you service? Are you just local in Miami?
So we service all of Miami-Dade, Monroe, and Broward counties.
So the Tri-County area.
Well, the Tri-County area, except for Palm Beach. That's a move that we had planned on making, but COVID shelved the plan for a little bit. But that'll be our next move into Palm Beach, and then after Palm Beach, we'll be moving into Collier County, which
that's fantastic.
The Naples area.
That's fantastic. And with COVID, we just said COVID, the word, right? How have you had to adapt during the pandemic with caring for patients?
Well, COVID has been challenging. It's been challenging, not just for us. The one thing that was lucky about us was that we were deemed an essential business, so we didn't have to shut down. But we definitely, today from last March of 2020, we've evolved tremendously with the way we handle COVID. We had 3 shifts for a long time. We separated our office into 3 shifts so that we didn't have any two groups together at the same time in case one group got infected or had to go because of contract tracing. So we had Team A, Team B, and Team C, and we would go different days of the week. And that ended, I would say, about 4 months. For about 4 months now, we've been in the office completely. Everybody's been in the office, and Broward County was always going every day because our operation in Broward's a little smaller than our operation in Miami-Dade. But it's been a challenge. We've cared for both COVID positive as well as COVID negative clients, and we have to supply full PPE, which is personal protective equipment, to the caregivers that are going into COVID positive situations. We have to give them hazardous pay, which they're requesting, and I believe they deserve, because they're putting their lives at risk. So we've done the full gamut. We're caring for both, like I said, COVID positive and negative cases, and so we've kind of gone into our flow now, and so now it's the new normal for us operating in a COVID environment. So hopefully it comes to an end soon, now that the vaccines are being distributed and being given out there. So it's been challenging, but it's been rewarding as well, being able to care for people in a time of need. And it's not just a time of need, but a time of need where people don't know a lot about the disease and how it's going to affect them. So
right, there's a lot of unknowns.
Yeah, it's been a learning experience, but it's been fun. It's been a lot of work, and everybody in our office gets tested every 8 days. So we have a designee in our office that has to capture the results and put them in a notebook and keep everything up to par.
And your caregivers, they come into the office as well?
The caregivers, well. Another thing that we did during COVID, we instituted check delivery so that we wouldn't have caregivers coming to the office. We put up plexiglass, like this wall between you and I. We have plexiglass dividers to help the people that do disperse checks in our office keep distance from the caregivers. But we were doing a lot of check delivery. It's dwindled down a little bit now, but we did check delivery for a long time, and to have less people coming to the office. So we've taken all the precautions, and knock on wood, we've been very lucky. We've been very lucky.
Thank God. Does insurance cover your services for patients?
So that's a great question. When a lot of people need custodial care, because we do both skilled and unskilled nursing, and skilled nursing is usually done with a doctor's order, and it entails physical therapy, occupational therapy, wound care, or any type of situation where you need an RN to go in there. Normally, that type of service is covered by your health insurance. In our case, the insurance that we accept for our custodial care are non-skilled, which is the bulk of our business. The bulk of our business is helping clients with activities of daily living, bathing, feeding, toileting, meal preparation. Fall prevention is a big deal for us. And the type of insurance that covers that is an insurance called long-term care insurance. Not everybody has it, but the people that do get great coverage, and it's something that I would suggest people look into, because seeing what it does for people now, it really comes in handy at a time of, in their older years when they're going to need some type of custodial care with activities of daily living. So on the skilled nursing side, we really work on a private basis, and talking about the private basis, Miami's a very unique market because we're a very international market, and a lot of people fly into Miami from all over the world for healthcare. Despite, people saying how antiquated our healthcare system is, everybody from all over the world still comes here when it's touch and go. Yeah. This is where they come for their healthcare. So we do service a lot of people that fly into Miami from all over the world that do not have health insurance here and have to pay their healthcare on a cash basis. So our skilled nursing, which is on a cash basis, is a very good component of our mix because of the international clients that we get here in Miami.
So skilled nursing is provided by RNs. The other is provided by
nurses' aides. It could be a CNA, which is a certified nursing assistant, or an HHA, which is a home health aide. Mm-hmm. The skilled nursing is provided by an RN, but it can also entail physical therapy or occupational therapy. So it could be a therapist or a nurse doing the skilled part of the equation.
Depends on what the needs are, is who gets sent out there.
Absolutely.
And what is the onboarding process for your caregivers?
So the onboarding process, we have a recruiting department in our company, and the recruiting department before COVID would go out to schools where nurses get their license, and we would do job fairs and meet the placement officers at the schools, et cetera. We also get caregivers through subscription services, but the onboarding process basically entails them coming in to our office and bringing all the documents that are required, their licenses, certifications, CPR cards, et cetera. We also go into the FBI to database to look at the background checks on everybody. Everybody that works in healthcare has a level 2 background screening, which means that their fingerprints go through the FBI database. It used to be that they would go through the Florida Department of Law Enforcement, but what was happening was a lot of caregivers were coming into Florida that had committed crimes in other states, and that wasn't coming out on the database, so they've federalized it all now. Uh-huh. So if they have committed a crime somewhere else, it'll come up in the FBI database.
Well, that's good.
So very important.
Very, very, very important. Especially when, you're hiring caregivers for your elderly parents or whoever you're hiring a caregiver for. You want to make sure that the people that are coming in are safe. Yeah.
So, and on that note, that's a good point you bring up. The elderly make up the bulk of our business, but there are people that get knee replacements, hip replacements, all types of surgeries that need help with activities of daily living during their recovery phase. For a long time, we've taken care of plastic surgery, cosmetic surgery patients that also fly in from all over the world to Miami to get cosmetic surgery, and they need help for 48, 72 hours post surgery. So right. The gamut runs: elderly people and younger people. The younger people, obviously, the case comes to an end quicker than the elderly. Sometimes the elderly were with them until they pass, and sometimes we're with them, for a long recovery, depending on what procedure or surgeries they've had.
Yeah, I probably should have been smarter when I had my hip replaced and gotten help, but I was way too stubborn. I'm like, I'm going to do this by myself. So is vaccines, we're all talking about vaccines right now for COVID. Are the vaccines available to your caregivers? Are they considered frontline?
So the caregivers are considered frontline, and they do have contact with COVID positive as well as COVID negative patients. The vaccine is available, but not guaranteed. They've had some hiccups distributing the vaccine in the state of Florida, but there is a website which is myvaccine.fl.gov, where if you're over 65, if you're a frontline worker, if you have some compromised situation where you can qualify for the vaccine, you can sign up for it. And there's different locations in Miami-Dade. It's Marlins Park and Hard Rock Stadium, where they can get vaccinated. In Broward, there's like 6 or 7 places that they can go get vaccinated. One thing you have to do, whether you're an RN, a CNA, a therapist, whatever you are, you have to take a pay stub to show that you're actively working right now in the medical field to get the vaccine. But they are available. Check out the website. Again, it's myvaccine.fl.gov. And that's for the whole state of Florida. It'll ask you to put in the county where you're looking for, and absolutely get vaccinated.
Yeah, and I would imagine they get prioritized once they're put in that they're a healthcare worker.
Yeah, the vaccines that are out there right now require 2 vaccines. So the Pfizer and the Moderna, one of them is 28 days in between, and the other one is 21 days in between. So you do have to go back and get the second vaccine. And in my experience, I've seen some people get sick after the second vaccine for a short period of time.
About a day.
About a day. They could get high fever and chills for about a day, and then they get over it. And some people go through both of them without any side effects whatsoever. So, but definitely I recommend getting the vaccine.
Yeah, me too. But I'll be, as I was at the pediatrician with my son yesterday, and I was like, well, I'm not going to be getting it anytime soon. He's like, yeah, you'll be second on the list and your son will be last on the list, but we'll get it when we get it. So if people are interested in finding out more about 24/7 healthcare, where do they go, nursing care, to find more information?
So we have a website. Our website is www.24-7nursingcare.com. You can get a lot of information there. I'm always out I used to always be out in the street marketing. But we can also be reached toll free at 855-NURSE-44. That's 855-NURSE-44. That's a toll free number.
Are you on social media?
We are on social media. We do a lot of social media, actually. We do a lot of SEO as well, search engine optimization on the website as well. But we can be found on Twitter, Facebook, LinkedIn, and we do multiple posts a week. So we are on social media. We love what we do. We love caring for our community. Call. It's there's nothing's binding. You could sign up with us, see how it goes. A lot of people are afraid of how their loved one is going to react to having help in the home, which sometimes they're stubborn and react indifferently to the caregiver. But again, we're very flexible. We're very easy to work with. I tell people, let's get a schedule. Let's try it out. Let's see how they go. It's been my experience that once the caregiver gets in there and develops a relationship with the client, then they're indispensable. Yes. They never want to let them go. So, we work on very affordable hourly rates, day shift, night shift, weekends. Again, it's 24/7 nursing care, and give us a shout, and whatever the situation is, we can help you case manage it. And we also have a lot of resources for things that are related to the medical field that have nothing to do with our business. I've been in the medical field most of my adult life. So we also, besides providing the nurses aides, we become a resource for our clients on how to navigate the healthcare system, which could be pretty complex if you've never done it before.
Very daunting for those that don't know how to navigate it.
Absolutely. If you do have long-term care insurance, we handle all the billing. We get as involved as the clients want us involved. So some clients would rather communicate with their insurance carrier themselves. Some would rather us do the whole thing and receive payment. Sometimes we bill it, they get paid, and then they issue us a check. So whatever it is, again, I've been in the Miami community for most of my life, and so I know a lot of people here, and we've cared for a lot of people here. So no job is too small, and no job is too large for us to handle.
That's fantastic. Is there anything else we haven't covered about?
I think you've done a pretty good job, Jen. You've been pretty thorough. Again, we got to get through this together. This pandemic is, hopefully we're on the other side of it already with the vaccinations, but now we have the 2 new variants or 3 new variant strains. So hopefully we're able to get a grip on this and go back to life as we all knew it before. I miss it.
Me too. Very much so, but, as you said, we all have had to adapt, and we've, created different ways to get the word out there for our businesses and our organizations and things that we're doing. But, thank God things are starting to open up a little bit.
Absolutely.
Like next week with Pinecrest Business Association, we're having our first in-person meeting in a year.
I can't wait.
We're very excited.
I can't wait.
We still have a few spots open. So if you would like to join us, go to pinecrestbusiness.com and register for the luncheon. Ron McGill is going to be our speaker. He's always very entertaining. Lime is our caterer. Everybody loves their food. I can't wait for my chicken salad. And
I will say something, besides being the president of 24/7 Nursing Care, I am a member of the Pinecrest Business Association, as Jen pointed out.
And a board director.
And a director. And I've made a lot of contacts at the Pinecrest Business Association. It's been worth every penny that I've paid for it. And so I suggest, you got to get out there to make things happen. And a great start would be to join the Pinecrest Business Association.
It's really a nice group of people. And we're all about local businesses, helping local businesses, and we stay true to that. So if you would like to get, more involved in the community or more involved in local business, we do encourage you to check us out. And if you're not ready to join us in person, we will be having the meeting on Zoom and Facebook Live too. So you can watch us and not join us if you're more comfortable with that. But we will be following all CDC and Village of Pinecrest regulations. So we do look forward to either seeing you there or seeing you there virtually. And thank you, everybody, for watching. Thank you, Luis, for joining me today.
Thanks for having me.
And we'll see you next Thursday at 1, and we'll hopefully see you at the luncheon on Tuesday. Thank you, everybody, and have a great afternoon.
Have a great